The UN Office for the Coordination of Humanitarian Affairs, OCHA, says the cholera outbreak in Guinea and Sierra Leone is slowing down. The organization reports that between late August and mid-September, new cholera cases per week have dropped from just over 2,000 to 1,400 in Sierra Leone and from slightly over 1,100 to 346 in neighboring Guinea. OCHA officials say the situation is improving faster in Guinea in terms of new cases and in Sierra Leone in terms of its capability of causing death. They say these developments are positive but warn caution. The organization calls for sustained measures to wipe out the disease. And the United Nations is holding a high-level meeting on polio Thursday called Our Commitment to the Next Generation, the legacy of a polio-free world. Joining us on the phone from New York to tell us more about the meeting is Kate Dodson, Executive Director of Program Integration at the UN Foundation. Ms. Dodson, welcome to In Focus.
Thanks, Linord. Glad to be here.
Well, it's good to have you. Tell us, why is this upcoming meeting so significant?
Well, we are actually more than 99% of the way there to eradicating only the second major disease in history after smallpox. But we must not lose sight that 99% is not 100%. We're at the lowest number of polio cases in the fewest geographic areas, and we need a commitment of global solidarity to get over the finish line.
And what type of commitment are we looking for?
You know, commitments of solidarity, commitments of funding, and really elevating this issue to a global stage. We have 120 heads of state in New York this week. It's really a unique opportunity for the global community to rally around this issue and get over the finish line.
So in 1988, there were about 350,000 cases of polio. Today, there are about 137. Why do you think that today, more than ever, there is the need for push if the cases are so low?
Well, we're down to just 3 endemic countries where polio has never been eradicated: Nigeria, Pakistan, and Afghanistan. We had a big milestone earlier this year when India, long seen by the global community as the hardest place to eradicate polio, actually went more than 1 year without a single case. So it's officially ended transmission. So that gives us really renewed hope that eradication can be achievable. In May, the World Health Assembly, the convening of all health ministers around the world, unanimously called the eradication of polio a programmatic emergency for global health. But the funding gaps remain. It's one of the biggest challenges to getting to eradication. This year so far, we've had to cancel 24 campaigns, immunization campaigns in different countries, and we're at risk of backsliding if we don't rally together to get over this finish line.
Now, who will attend this meeting on Thursday? Who are you expecting?
The Secretary General is actually hosting and convening this meeting, which is a testament to the fact that he's called polio one of the major health priorities in his second term. We'll expect statements from heads of state of those 3 endemic countries, Nigeria, Pakistan, and Afghanistan, as well as real long-standing global champions like Bill Gates and Rotary International. We'll also have some major donors and long-standing donors, again, renew their support for this effort, including the U.S., the U.K., Australia, and Canada. And excitingly, we'll be able to announce new financial commitments from a network of new partners that will be present at the event as well. And that will go a long way to help fill some of the critical gaps in the coming months and years.
And you almost touched on my next question. What should we expect? Any major announcement?
We will see some major announcements, some new players, some new actors in this space, and that's a real key point of this global eradication initiative. We have 52 donors that have supported polio eradication to date, and that's a remarkable commitment of global solidarity, but we do recognize we need to build on that. We need to grow. Everyone has a role to play, whether you're, a citizen advocate and donor, or you're a major, head of state of one of the endemic countries.
Oh, okay, Ms. Dodson, thank you so much for joining us.
Thank you for having me.
Great. And that was Kate Dodson, Executive Director of Program Integration at the UN Foundation. Well, that's our Africa Health Network for today, Africa Health Network report. For more health news and development, be sure to visit our website, africahealthnetwork.com. And Vincent, that's it.
Well, thank you very much, Linord. Be sure to watch for Linord Moudou's Africa Health Network reports. It's every Tuesday and Thursday right here on In Focus.